All right. Hello, everybody. My name is Brandon Oliver, and I'm the Director of Marketing and Communications here at East Central ISD. And we have a very special Facebook and YouTube Live tonight. So much is going on, so many things are happening. And so we have the superintendent with us tonight. And so I want to bring on Superintendent Roland Toscano. And Mr. Toscano, it's been a flurry of activity recently. And I'm sure you're going to let us all in on what's going on.
Yeah, it feels like I'm in the movie Groundhog Day, and I feel like I've lived this moment before. We have been back, as a teaching core and a leadership core for a few weeks now, and we're really high energy, very excited about the upcoming year. So eager to welcome our kids back. We've got so many students in extracurricular activities who have already begun. And there's just a ton of energy and excitement. We're seeing enrollment numbers greater than we've seen ever before at many of our campuses. And so, I really thought that tonight's conversation was going to be about all of those things and all the things that we're excited about for the upcoming year. But unfortunately, we're going to spend some time today talking about things it seems like we've been talking about for a year and a half. And so it's important that we do that. So I'm going to jump right in, Brandon, if it's okay.
Real quick, I just want to remind our viewers, you can go back and watch this at any time. It's being recorded, so you can watch it at any time. And then we will do a question and answer session, excuse me, but we will do that at the very end after Mr. Toscano's presentation. So we will take questions from the audience, but please wait to ask those questions because sometimes the comment box gets so full that we're not able to see the early ones. So wait until Mr. Toscano is done with his presentation and we'll do the Q&A. So, all right, Mr. Toscano, go ahead.
Yeah. So first of all, thank you all for joining this evening. And if you're watching this as a recorded a message, then thank you for watching the recorded message. I always want to encourage the community to engage with us in two-way conversation. If you hear anything tonight that you think about later, that you want more information about, please reach out. If you've got some input, some suggestions, or some feedback, please send those our way. Because this is our community and it's our schools and our children. So we've got to do this thing together. Our message around, what's going on with the virus at this time is that our number one objective is always to keep everyone safe. Our board has been very clear about that. We put structures and systems in place to ensure that we had the tools that could inform our decision-making around making sure that our kids and our staff were safe at all times. We also know that if we do that well, we can keep everybody at school and we can keep everyone at work. And we also know that we're super eager to get back to better than ever before. We learned a ton in the last 18 months, and we learned a lot about what we don't ever want to do again. And so we are prepped and ready to get back to better, and we're eager to do that. So here's what we know. We know that in June, Governor Abbott sent an order across the state of Texas that prohibited any mask mandates in government buildings, and specifically cited schools as facilities that could not mandate universal masking for anybody in the facilities. And our legal counsel at the time said that is absolutely what you have to adhere to. And we've done that since June. I'm happy to report that our community has been fantastic. Our students and our staff have done everything they need to do to take care of themselves and one another. And we had a very successful summer under those conditions. We recently, in the last 24 hours, saw some activity at the city where San Antonio and Bexar County sued the governor of Texas. And they were granted a temporary restraining order, which essentially enabled San Antonio Metro Health to, under the state of public health emergency, issue a directive which mandated masks for all those in public schools in the city of San Antonio and Bexar County. And so at this particular time, our legal counsel is advising that that's what we have to follow at this time. Now, we're not 100% sure about the timing of what happens next and what the legal mechanics are, but we're led to believe that the next step will be that the state of Texas will appeal to the Supreme Court, and that it would be elevated pretty quickly, and that there'll be an opinion from that level which could uphold our current requirements and or could change them. And so, that's something that creates quite a bit of confusion, sometimes some frustration. I hope that I have explained kind of the circumstances at this time, and I ask for your patience, as this could cause us to toggle back and forth with regard to are our students and staff and visitors required to wear a mask or not. And at this particular point, it's not an option due to the mechanics that I described a few minutes ago. We also have utilized the San Antonio Metro Health COVID dashboard throughout the course of the pandemic. And we can see very clearly that dashboard indicates a worsening trend. When you look at the 5 indicators that have been part of monitoring the path of the pandemic, you can see that 2-week decline, hospital trends, average case rate, positivity rate are all in the critical category. You can go back really quickly, Brandon. And hospital stress is at severe. So taken together, the community risk level is in the severe category and trending towards critical. So we also monitor the progress warnings and indicator dashboard, which Brandon went to a moment ago. And we just kind of monitor trends. And, like we've all heard in the news and what is being reported to us by Metro Health, as well as the hospital systems in the city and county, is that, this variant has caused an uptick in positivity and hospitalization rates. And so that's what's caused this Metro Health dashboard to indicate severe at this time and trending up to worse conditions. They've also reported to us that we're in a little bit of a different circumstance than we were last year. In the hospitals, it seems like the city was able to get some support in the workforce of nurses. It sounds like we're about 15 to 1,600 nurses down from where we were in the height of the pandemic last year. And so part of the issue is not necessarily ventilators that are available. It's that we just don't have as many nurses to take care of the patients in our ERs or intensive care rooms across our hospital systems. And it also sounds like here of late, our available beds is beginning to be stressed. And in fact, Dr. Wu just sent out an update in the last 15 minutes saying that we've now exceeded June hospitalization numbers in the area, and that we've also exceeded the EMS transports for COVID-related symptoms from December of 2020. So, just comparing the circumstances to the surges that we've seen in the past, it sounds like, we've got some cause for concern as a community. And most recently, there seems to be an uptick in cases of COVID for children under the age of 12. Which is an emerging trend. I don't know that it's conclusive yet, but it sounds like they're beginning to see an uptick there, and subsequently hospitalizations possibly as well. On our health services dashboard, another tool that we've made available throughout the pandemic and will continue to make available on our website. If you go to departments and health services, you'll see the health services page. And you on the left will see several resources that I want to call your attention to, especially if you're a new parent in the system. And the first is that we've created some COVID-19 FAQs. Those are up to date and answers many of the questions that we receive through social media and through our Talk to Us tabs on our web pages. And we attempt to respond to those and update those as things change. If there's one thing that we know about the pandemic, given our previous 18 months of experiences, one thing that's certain is things are going to change. And so the effort here is to communicate in real time, to communicate frequently, and sometimes even over communicate, and be as transparent as we can and give you the opportunity to offer as much feedback and input as you can along the way. We also have created a quick reference, which we sent out on social media last week. And again, this is a 8 things parents need to know kind of document that you'll also see there on the health services page. That's kind of a high level, down and dirty overview of the things that we're suggesting, encouraging, as well as implementing, continuing to implement across our schools. And of course, the latest version is always going to be what you find published on the webpage. And then lastly, you'll see case numbers. And this is something that we transparently published throughout the last 18 months. And as school starts next week, we'll continue to do that, where we identify positive cases. This is last year's data for the entire year. Not total number of cases, number of adults, number of students. And then we break it down by zip code throughout the community. Those are our zip codes. So we track it by that. And then we also delineate between the positive number of students and the positive number of employees by site throughout the district. And then as Brandon scrolls down, or as you visit that page, you'll see cumulative numbers by week, so we can see if there's any trends. And the trends that we experienced last year kind of mirrored the surge trends in the city and county. And so we could only anticipate a likelihood that as school starts, we might see a little bit more of an uptick in positive cases than we would as we see the latest surge to regress. But we'll monitor those. We'll publish those. Our communication protocols are going to stay the same. Our contact tracing procedures are going to stay the same. Our collaboration with local health officials in contact tracing is going to mimic what we've done over the last 18 months. And I'll talk a little bit more about the additional risk mitigation protocols that we implemented, that we'll continue to implement throughout this year, and in particular as we experience the current context of COVID-19 that we're in right now. And then we also have always referred to our reentry protocol. And you'll notice that the phases and the colors at the toolbar at the top for each column mimic the San Antonio Metro Health dashboard. I will say that this is always a live living document. We have to adjust along the way as we receive different orders or directives that we must adhere to, and updated guidance as the medical community learns more about COVID-19 and most recently the variant. And so we're in phase 4 according to the dashboard. What we've most recently amended was reflecting the governor's order that we were following, and that was that we could not mandate masks, but we could recommend or suggest or even request. And so the language in there as you move from phase 1 to phase 5 gets a little bit more urgent in terms of how strongly we recommend masking. But of course, as of today, we have to mandate mask. And so again, that could change in a couple of days or in the upcoming weeks. We don't know, but we'll adjust depending on what we're actually doing going forward. The other thing I want to point out is that you'll see across the column, transportation is going to be at 100% capacity all year as it currently stands, and academics, actually buildings, capacity of our buildings is going to be at 100% this year. I'll talk a little bit more about this later, but there's currently no remote option as a modality of instruction for any students that we do not have the ability to do that. That takes legislative action before TEA could authorize that. And I think we all know at this point that that's not been the case. The legislature is in a special session right now. And again, I'll talk a little bit more about that as we get towards the end. But this is, again, another tool that we refer to at the board level and district level as we respond to what we're tracking on the COVID dashboard for the city and the county. Okay, so public health guidance. we as I've mentioned, we work very closely with Metro Health, but we also monitor the CDC's guidance as it changes throughout the course of time, and the Department of Health and Public Safety dishes, and subsequently TEA. And we find that those things eventually all kind of land on some common sets of guidelines. And so at the highest level, it seems that all of those, to include TEA guidance, are recommending strongly, and in many cases, very strongly, recommending folks consider getting the vaccine. They recommend that folks mask up. And we certainly, I'm an educator. I'm not a medical health professional. And so we rely heavily on our medical health professionals to give us the best information. But like all of you, there's so much conflicting information out there from different medical sources, from social media, from different media outlets. And so, we do the best we can to, kind of stick to the COVID dashboard and the guidance we receive locally. But we do realize there's conflicting research. Sometimes there's conflicting data and messages that create a lot of discourse around the degree to which masks are effective, the degree to which the vaccine is effective, and the risk associated with all of those things. But over the course of the last 18 months, what we've experienced is that, number one, we can't conclude which risk mitigation effort is more effective than the other. We can't really make a correlation there based on our data, but our inference is that, taken together, all of the different layers, if you will, of risk mitigation seem to have made a big difference. We still to this date have not had one official outbreak, meaning that a student or a staff member had contracted the virus, and we could confirm in collaboration with Metro Health that they transmitted it while at school or at work here in the district. And we need to keep it that way. And so our only conclusion is that all of the things we did together, taken together in terms of risk mitigation, must have made an impact. And then, of course, what we all did individually and as a community outside of school, seemed to have contributed over time. And so that's the only thing that we feel like we're pretty confident in. We also, according to the public health guidance, know that all positive cases of COVID-19 will require a 10-day quarantine. That's down from 14. I believe that Dr. Wu's order yesterday also recommended that we go back to 14, but currently it's a 10-day quarantine requirement, as best we understand. And if a student finds himself positive and ends up in a 10-day quarantine, we also learned in recent weeks that there is a tool available to us to support the child while they're in a medical at-home condition, which a quarantine would qualify for, that we can provide support through remote conferencing. And remote conferencing essentially for us means that through your child's teacher's Google Classroom or classrooms, there will be a remote conferencing Google Meet link that will be live every day of the year. And for the time your child's at home, they can log on. There will be a remote conferencing facilitator live on the other end to support your child as they work through the assignments and the instructional materials that are provided from their teacher on the Google Classroom, and then submit work throughout the day and days to their teacher directly, while at the same time being able to get some support from the remote conferencing facilitator on the other end. We're staffing that up at all levels throughout our system, and that will be a tool hopefully to prevent any lags in some short-term quarantine or isolation situations a child might find themselves in. We also know that any student or staff member that's showing symptoms of a communicable illness, this is not new, this has always been the case, as determined by the nurse. Usually that's triggered by a fever of 100 degrees or higher. The nurse has to make a call, and only the nurse has the authority to do that in our system. And the nurse can make a call to send the child home until they're symptom-free for 24 hours. That's always been the case, and we found ourselves with COVID-like symptoms having to do that many times in the last 18 months. We'll continue to do that going forward. We also know that if exposed or in close contact with someone who tests positive, that those who we are able to confirm have been vaccinated or those who have had contracted the virus for within the previous 90 days are determined to have antibodies, that both of those circumstances would not be determined to be in close contact and would not be required to quarantine. If exposed, however, a vaccinated person or a person that we can confirm has antibodies, it's still recommended by all of the public health guidance I mentioned earlier that they wear a mask in the interim, even though they're vaccinated, but because they've been exposed, either for 14 days or until they can get a negative test result. It's become very clear through the medical community that the incubation period for the COVID-19 variant we're dealing with today is shorter than the incubation period for the alpha variant of COVID-19. So before, it used to be 7 days that it would incubate before you might see symptoms, but now it seems to be 4 days. So what that basically means is if you're exposed, if you have a negative test after the 4th day, then you're in the clear, right? And so for anybody that finds themselves in a close contact quarantine situation, they can come back after that 4th day if they have a negative test. And for those who have been exposed but don't have to quarantine because they're vaccinated or have the antibodies, mask for 14 days. If we get back into a situation where masks are optional, we would strongly encourage mask until they can get that negative test after 4 or 5 days. And the whole issue there for us is we're thinking about contact tracing and the rules associated with it. We don't want to find ourselves in a situation where other employees have to go home. But even more important than that, we don't want a situation where, one of us as adults unintentionally, because we're not careful, exposes students who are either unvaccinated or weren't wearing a mask. And then we've got large numbers of students that have to quarantine. And so from the contact tracing standpoint, we just have to be careful and be mindful through that lens. And that's what we've done over the last 18 months. We'll continue to do that. We understand that unvaccinated staff or students are required to quarantine every time when they're in close contact, and that they can return, as I mentioned before, with that negative test after 4 days, provided, again, that test is a PCR test. But we also recently learned, so that would be the only official test we would allow for an employee or student to come back after being quarantined after that 4-day period. But we learned that Walgreens and CVS seems to sell a very reliable in-home test. And so it's a possibility, if you can get a hold of those, that before you go get that PCR test, that you could utilize one of those as an indicator of whether you should go get that PCR test. So you go get the Walgreens test after day 4, you test and you're negative or positive. You might then want to confirm that, depending on how, what you think about those results with the PCR test, because that PCR test comes back negative, then we can get you back to work and back to school after that 4-day runway period. The guidance up until the recent order from Dr. Wu said that masks are recommended for everybody, but especially for those that were unvaccinated currently, or those without antibodies. In other words, the confirmation of antibodies comes from, in this guidance, having had a confirmation of positive for COVID-19 in the previous 90 days. So our best guess currently is that about 60 to 70% of our employees are fully vaccinated. We think that it's a much higher percentage who have taken the first dose and are awaiting the second. So we've got a pretty good population of our employee base that are vaccinated. And, what we've encouraged folks to do is to share their vaccination status, if they're comfortable doing so, with our nurses in confidence, because that helps them with contact tracing. Because, as I mentioned before, folks who are vaccinated, if they find themselves exposed, do not have to quarantine. In addition to that, we feel like we could confirm that about 25 to 30% of our students who are eligible for the vaccine are vaccinated, but we're also asking for those who are comfortable doing so that families consider sharing their vaccination status with their school nurse, as well. Again, only so we could build that database so that we could know in a contact tracing situation who we need to recommend or request quarantine for and who we do not. It just helps us expedite that contact tracing effort. And again, these are just requests; these are not required, but it would be helpful for us as we attempt to keep everybody here at school and at work. What we also understand about the variant. I've said several things that we seem to understand. I hesitate to say that we know because we're just like all of you. We're trying to learn and confirm our sources and just make the best decisions we can with the best information we have. So our understanding about the variant as it currently represents our best thinking and understanding is that it's twice as contagious. That the majority of folks, some hospital systems report, low to mid 90 percentages. Some are reporting upwards of 97%. That those hospitalized are unvaccinated who have contracted the variant. We've heard anywhere from 7 to 10% of cases, and that perhaps that percentage is growing, but a very small percentage of cases are breakthroughs, meaning folks who have been previously vaccinated or previously contracted the virus are now have recontracted the virus or contracted it after being vaccinated. The report suggests that generally speaking, they experience minimal symptoms, oftentimes asymptomatic, and that they carry a low viral load. So once you've had the virus and you get it again, the viral load that you carry is much lower. If you've been vaccinated and you contract the virus for the first time, you still have a lower viral load, which makes it less likely, substantially less likely that you would transmit the virus to another person. And it's even much lower than that of a probability that you would transmit it to another person who is vaccinated or that has the antibodies. As far as children under the age of 12, we know that the vaccine is not currently available or not yet available for children under 12. But the reports that we have been receiving up until today is that the effects are very similar as the effects of the alpha virus of COVID-19 were on children, and that basically the rates of infection are very low when compared to the adult population, and the rate of transmission from student to adult or student to student is also very low. I won't even begin to try and convince you that I understand the science behind it, but it has something to do with the ACE2 carriers on cells are not as developed as they are in adults, and so it's less likely they contract the virus, feel the full effects of the virus, or transmit the virus. And again, that's just as I understand it. Could be a little bit off there, but similarly, the current variant is affecting children under 12 similarly. Vaccinated folks and those who are wearing masks or those with antibodies overall are still experiencing low infection rates and or illness, even if they contract the variant. Data suggests that children under 12, as I mentioned before, rarely contract or transmit the virus. It includes the variant, and that they very rarely transmit it to one another or to adults. But apparently, as I mentioned at the onset of this conversation, Dr. Wu and local hospitals are reporting that they're seeing increase in numbers when you compare them to the previous surges of the alpha COVID-19. We're actually seeing more transmissions from students to others, or children under 12 to others, than we did previously. So there is some reports that things could be a little bit different this go around. And consistently from the previous surges to the current variant surge, it is more common for adults to transmit the virus to children. And this is one of the primary reasons that we've encouraged all of our staff to consider taking the vaccine, because again, we don't want to be a reason why, certainly why children contract the virus, but definitely another reason why kids may have to quarantine at any point throughout the year. As previously mentioned, we suspect that about 25 to 30% of eligible students are vaccinated, and medical community is telling us that this particular surge of the variant is essentially being transmitted from and to the unvaccinated population. That essentially this current surge is really centered around the unvaccinated population in terms of its surge. As also I mentioned before, we've been very blessed and fortunate to not have any outbreaks throughout the pandemic. And as I said before, we need to keep it that way. We just do. And overall in East Central ISD, the state, the country, during the previous 18 months, spread in schools, fortunately, was very minimal, relatively speaking, right? There was a lot of fear that once kids went into school that we were going to see this mass propagation of the virus in the previous 18 months, and that just didn't happen. And so we hope that that continues to be the case as we re-enter school next week, but we need to do what we can do to make sure that that is the case. So I have a few, requests or recommendations based on all of this, some of which I'll just reiterate. One of the requests is that adults and students and families, that we just self-monitor daily. How are we feeling? Are we experiencing any of the symptoms that we got real familiar with over the last 18 months? Are we feeling sick? Do we have a fever? If we do, we need to stay home. Let us know. If you have COVID-like symptoms, get tested, communicate with us so that we can help get you the care that you need, but also that we can protect the entire population and prevent that outbreak, right? We are going to forgo the daily screener. We use that thing for the better part of a year and almost a half, and our nurses reported that it sent us on more wild goose chases than it informed us and helped. And so we're going to forego that. We feel like we all now have a pretty good handle on what those symptoms are and what we should do if we're experiencing any of those. And so we're not going to come to work or school if we're symptomatic, and we're going to notify and communicate with one another. And then, you'll consider getting tested if you feel like you might have the virus. And again, you can do the PCR formally, or you can do the at-home test from Walgreens and CVS, which is what our district's physician recommended based on her experience in terms of reliability. I recommend that you consider wearing a mask indoors. Of course, we have no choice at this point with the most recent directive from Dr. Wu. And if unvaccinated, whether we had an option or not, I'd recommend, while we're indoors and while we're around one another and kids, that we, if we're unvaccinated, we consider wearing a mask. And again, as adults, we're thinking about contact tracing. As a parent of a child in the system, I'm thinking about contact tracing, right? Like, I don't want my kid to end up being quarantined in any way, because I want him at school and I want him to participate in the activities he participates in. And by God, my wife and I are very busy and we work long hours and we don't have childcare for him. We need him at school. So whatever decisions we make are going to be around this idea that, we fear less about him contracting the virus or being really sick because of it. And we fear more about him ending up not being able to participate in school and school activities. We also know that good hygiene served us well. We learned about proper hand washing. We taught our kids and reminded them and modeled it. We know that when we cough or sneeze, we need to do that differently and consistently well, so that we don't expose others unintentionally there. And, it may be a time to consider the whole, the handshaking versus fist bumping versus, the elbow affirmation of good to see you. Those are, part of good hygiene, especially in surge situations like we're in now. It seems like to have made a difference in the past. We'll be offering weekly testing at all of our schools beginning the second week of school. It's voluntary for kids and voluntary for staff, but we encourage everybody to volunteer. And that was just one of the additional layers of risk mitigation that seems to make a big difference, especially for anybody 12 and over, to include adults. It seems to help us identify folks who have contracted the virus and have no idea, because the majority of cases still, whether the variant or the alpha strain, the majority of positive cases are asymptomatic. I think it's, 70 to 80% are totally asymptomatic. And so have no idea that they're exposing their family, friends, or classmates or teachers. And so this was just a way for us to get out in front of that and help keep us all healthy and at working in school. As I mentioned earlier, we're going to continue with every risk mitigation protocol that we had in place the last 18 months. That includes contact tracing, communicating within 24 hours to everybody that could have been impacted personally if it's going to result in exposure or close contact. And then we'll send the weekly communication out by location to the families that have children in each of those areas. And we'll publish it on our health services webpage that we showed you earlier. And we're going to continue our partnership with Germ Blast that we've had for the last 4 or 5 years. It's been fantastic at ensuring some really deep cleaning of all of our surfaces, facilities, and buses several times throughout the year. And then in between those, on a daily basis, we've got very intensive sanitization protocols that we implement as a team in multiple layers. So our custodians use multiple disinfection techniques to include e-misting daily and frequently throughout the day. And every teacher wipes down surfaces between groups of students and as students move throughout each lesson. And then we have hand sanitizers, dispensers everywhere in our buildings, as you all know. And so we'll encourage all of those layers of disinfection and sanitization. And, it's just good for flu season, cold season. It's good for all of us. I think that many of us probably experienced, like I did in my family, we seem to have been less sick in the last 18 months than we have been in recent years. And we think it might be a combination of all of these mitigation behaviors that have become new habits for us. And so COVID-19 or not, these are just good things to do to take care of ourselves and one another. Another couple of things that I think are worth talking about is that as we wear masks and in the future, is if we get into a place where we can opt to wear a mask, that we got to wear them correctly. We found ourselves helping kids to wear those things correctly. It's a little bit more of a challenge with the younger kids, but we were shocked at how well they wore them overall and how consistently they wore them. I mean, absolutely shocked all the way down to the little bitty youngest learners. But you got to wear those things regularly or they don't have the intended effect. We know that. They got to be cleaned. If they're disposable, you can't wear the same one most of every day and repeatedly day after day. And if you're wearing one of the cloth variations, those things probably need to be changed throughout the day and definitely need to be disinfected. You can't wear a dirty mask, or it's actually probably more unhealthy for us than not wearing a mask. So that's going to be important as folks are wearing masks. We're going to distance to the extent possible. We're in a situation where we're 100% in person. The number 6 feet, 3 feet, those things have fluctuated and been thrown around. But we know that indoors, if we do all of the other things, that distancing alone isn't going to put us at great risk if we're doing all of the other risk mitigation that we've been talking about here. But teachers are going to continue to find ways to manage distancing, change the makeup of student groups, don't have students in the same group for an extended amount of time, that 10 or 15 minute window, disinfect between lunches. You'll find us continuing to do breakfast in the classrooms, making the whole group, much smaller, seem to serve us very well. We staggered lunch times at all levels, and at our secondary levels, we have the ability to eat lunches indoors and outdoors and really spread the kids out, move them around, and control distancing much more effectively than maybe we did in the past pre-COVID-19. So those things will be part of our protocols. Again, the weekly screening was very helpful. We have a ventilation protocol, air quality protocol. We had all of our systems serviced in the onset of the pandemic. All of our filters, belts, the operation of all of our systems are, we ensure that those things are operating efficiently and effectively. And then we kick those units on a couple of hours to dump the air in the buildings before any human being steps in them. We found that to be very aligned with the guidance that we received and very effective for us. We'll do that and have continued to do that. So those are, the things we learned seem to work when taken together. Those are the things we've continued to do throughout the summer. We had over 2,500 students and staff throughout the entire summer. And we didn't have any outbreaks in the summer. And that was a sign that maybe we were heading in a really good direction. And here lately, things took a little bit of a turn, and, we'll make the adjustments we need to make and get us right back into moving forward. But overall, no matter the circumstances, we're starting school Monday and it's going to be better. We've learned a lot about COVID-19. We learned how to manage it very effectively, individually and collectively, and we feel like we can do that with the protocols that we have in place. And where we get caught in the middle between directives and mandates and all of those sorts of things, we'll sort through those things at the district level and figure out what it is that we're obligated to do, and make the adjustments, even if they're just short term, and do what we need to do. So before we turn it over to questions, I have a couple more things I want to touch on really quickly. I want to talk a little bit more about remote conferencing and make sure that I'm clear. That is a tool that has always been available to districts. The commissioner made some adjustments that allow us to, through the nurse, confirm a medical condition that requires a kid to be out of school for an extended amount of time, but a short amount of time. We're not talking about a semester. We're not talking about a year. Those kinds of medical conditions, it may be more appropriate for us to pursue the path of homebound services to determine if a child's condition qualifies for that. We're talking about a quarantine-like time frame. We're talking about 4, 7, 10, 14 days. And if your child meets that condition, then they would temporarily be able to, while they're at home and their health makes them, ensures that they're capable of actually engaging in school, that they'll engage through that remote conferencing link and use their teacher's work on their Google Classroom to interface with their teacher daily. And as long as they're online for a minimum of 4 hours, they get attendance credit for the day and can keep up with coursework. And again, there'll be a staffer on the other end providing support throughout the entire day in a remote conferencing format. Not only is this not homebound, this is not remote learning. Again, remote learning is not something that we're authorized to do. And so we're starting the year by not offering it. I want to remind the community that throughout the entire spring, we surveyed the community. We sent applications to those interested. We went through a process for approving those that could qualify for remote learning if we were able to offer it. And I believe the number at the end of the year was about 115 kids pre-K to 12. It was a very small number. Circumstances obviously, may have changed or may continue to change. And so all I can tell you is if we're authorized to do that at any point and it's appropriate for us to do so, we'll have a process that's going to require some medical authorization through our medical professionals in the district. And we're going to have evidence that remote learning worked for you and your household. We have to have evidence that you thrived academically and maintained grade level status as you worked in a remote environment throughout the year. That those are the number 1 and 2 qualifying conditions if we find ourselves even able to offer it. The legislator is in a second special session, and as I understand it, the Senate Education Committee has made some amendments to a bill that was working prior to the session closing and prior to the challenges that the legislators had in the first special session. And so, it may get traction. It may not, I don't know. But if it comes to that and we receive TA guidance and the conditions are such that it makes sense for the board to consider and they choose to do that, then, we'll reach out to the community and make sure you have the best information. But I just wanted to distinguish between remote conferencing, homebound, and remote learning. Remote learning is not an option at this time. Homebound for those who have, pretty serious qualifying medical conditions that are going to cause your child to need to be at home much of the year or most of the year. And then remote conferencing is that more short-term option that allows us to provide support so you don't have gaps in those short-term absences for consecutive days. And that remote conferencing is only allowable for up to 20 cumulative days throughout the entire year. without needing special approval through the Texas Education Agency and the commissioner. So with all of that, I know there was a lot of information here. I know you've got a lot of questions perhaps that we can talk about here for the remainder of our time. But I also know that I want to remind you that this is being recorded and published, and Brandon will close with where you can get that where you can access this video and refer back to it later. But Brandon, do we have a few questions we could take here in the last 15 minutes?
Yes. Well, first, one thing that we receive a lot is, Austin ISD is having remote learning, or in some of the other districts are having remote learning. Is there a reason why those particular districts are offering remote learning?
Yeah, so some of the larger districts had larger numbers when they consolidated all of the requests and those that qualified in the same exercise that we did. So a huge district like Austin, maybe even a large district like Northside locally, might have had enough students to justify, pulling a small group together and providing a remote learning environment. And they had the funding to support that, because it is not funded. So it's an expense that is unfunded, and district's financial position, and again, the number of students needed to make sense to staff up and pay for locally. It's definitely in all of those districts not sustainable. It's a short-term solution. Unless, again, the legislator authorizes funding for remote learning, and the agency then gives us guidance and authorization to do that. So I think that some of the bigger districts are hoping to do that short term and then get some sort of relief should they have to do it long term. And being a district that is mid-size to small comparatively, it just didn't make sense for us, both financially and based on the numbers of requests that we had to end the year. In fact, we did not have one grade level of students across all of our schools in the district to make up one class in any grade level. And so it just, it wasn't financially responsible to do so. And our funding looks very different than a very large district with regard to the relief that we received through ESSER.
There are some questions about, class sizes and how that distancing within the class will work. Can you touch a little bit on that?
Yeah, as I mentioned earlier, our teachers are very prepared to manage, to the extent possible, how long students are in contact with one another as they group and move throughout a lesson. Students generally don't sit in one spot or with one group for the entirety of a segment of the day or a particular lesson. They're moving frequently. So throughout the course of the pandemic, even when we had smaller numbers of students in our rooms, our teachers did that, and where opportunities presented themselves to move instruction into different locations like hallways or even outdoors periodically, they took advantage of those things. But what we understand is that distancing is one of several risk mitigation efforts. We know that distancing can help, but standalone, it's not going to be a reason why, if we do all of the other things, a child is at great risk of contracting the virus, or an adult. It's when taken together. So when we use good hand hygiene, when we disinfect surfaces, when we mask up, when we when we distance to the extent possible, if one of those things we don't do as well or consistency, but the others we are doing consistently, taken together, it seems like the risk is still very greatly reduced. And there's no data to suggest that they're more at risk if you do all those things together and maybe one not as much. So that's kind of the guidance we've been given, and it's the circumstances that we find ourselves in, given that we're only offering face-to-face for all students at this time.
Right. So we moved from masks are encouraged to now mandated by the local agencies here. For those that are against wearing masks, what could they do? Like if they don't, for example, send their kids to school because they don't want their children to wear masks, what happens in that case, or what happens in the case if a child refuses to wear a mask?
Yeah, that's a really tough question, because we're in a position here where, we couldn't mandate masks before, whether we thought it was the right thing to do or not. And now we're in a position where we're not mandating masks, but Metro Health is, and we're not authorized to allow anybody into our buildings who's not wearing a mask. So, the easy answer is, whether we like it or not, whether we agree with it or not, we can't allow anybody in our buildings during this period of time that this order is in effect, or directive is in effect, without a mask. Now, the unfortunate thing is, it's much more complicated than that. You could have a child who's fully vaccinated, an adult who's fully vaccinated, who has the antibodies, who statistically are not at risk to themselves or others. And that's a pretty tough thing to say, you can't be here. And I fully understand that. And I wish we weren't right in the middle of all of this. But these are the circumstances that we find ourselves in. I think with any latitude that we have, our board really wants us to focus on keeping everybody safe at school and at work to the extent possible, and that we avoid really drawing a hard line in the sand one way or the other. But I guess our current context necessitates it, and we just ask for grace. We ask for patience, and for us to all work together. Where we land on this personally, politically, may be different than how we have to operationalize it. We here in school district, we just look at the data, we look at the guidance, we make our best judgment call, and over the last 18 months, it seems to have worked exceptionally well. We're very confident that with a directive or not, we could have moved forward and kept everybody safe at school and at work. But we've got some constraints that kind of force us to adhere to a particular directive, and as we did before with the previous order from the governor. And so that's just kind of the law of the land, if you will. We'll see how it plays out in the court of law, and it may cause us to fluctuate back and forth there. Our desire is to educate kids and take care of them and provide that service that we're obligated to provide for our community that we all signed up for. We want to be open and available to you each and every day, and we want you to have your rights extended, to take a vaccine, to not take a vaccine, to wear a mask, to not wear a mask, and all of those sorts of things. But again, that's just not the circumstances we find ourselves in at this particular moment, and it can change as fast as it changed. So we just have to work together, communicate with one another, be patient, and know that the enemy is not right here. We're inside the wire, guys. Like we're all the East Central community, and we're here to serve you and your kids, and the enemy's not here. We all want the same things, and the things we can't control are just that, and we have to mitigate it to the extent possible and make sure that it doesn't disrupt us or distract us from doing what we all signed up for, and making sure that we take care of you and your kids and serve the community in the best way we can.
And one more time, because there's certain questions I'm seeing we've already addressed. We've already addressed no remote learning and why, and some other things. But one of the things I keep seeing is, the medical exception. If a parent wants to, do that route, how do they go about doing that route if they want to have a medical exception?
Say that one more time. Make sure I understood it correctly.
So I know you said that there is some exceptions, possibly for remote learning, remote conferencing, not really remote learning, remote conferencing. If they have a qualifying medical exception, how do parents that want to apply for that exception, how do they go about that process?
So remote conferencing is something only the nurse can qualify a kid for. So it depends on the obvious way is if they tested positive for COVID-19 and have to be quarantined, or if they've been in close contact and we can't confirm vaccination status or that they've had the virus within the previous 90 days, then they have to quarantine. So if they're in a quarantine situation, they qualify. But the same thing could happen if they have other illnesses or other injuries that require them to stay home for a short time, but an extended amount of time, right? Then they could qualify. And so once the nurse determines that, working with the family and their physician, then we'll get that information and connect them with the remote conferencing information and the remote conferencing facilitator who will work with them during the time that they're out.
All right, we have time for a couple of more questions here. But I've noticing in the chat, it's very sensitive. You know what I mean? And parents are definitely on one side or the other, and rightfully so. They're looking out for the best interest of their own children. But it is important, I think, as a community to realize that we're in this together. I mean, we use hashtag Proudly United, EC Proud, things like that, but we are in this together. And there's going to be things that are out of our control, like as you were saying, the mandates between state and local and such as that. But is there anything that you can offer to the community? Because both sides are passionate, very, 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 very passionate. Is there anything you can offer to the community in terms of unity in seeing this, that we are all in this together?
Yeah, as I said before, the enemy's not right here. We all want the same thing, and there are some constraints that we're working within. We also know that over the last 18 months, it was a very small percentage of students that were not negatively affected by the conditions. We saw very clearly in East Central and in the state across Texas that every student, with the exception of a very small percentage, suffered academically. And that included students that came to school every day for the last 18, to the extent that we weren't closed, right, which was very minimally, that came to school every day because of the concurrent instruction model. And that there were a handful of circumstances, less than 10%, which is actually what is authored in the bill that is being worked on currently to authorize remote learning, that you cannot author it. We will not be authorized, if it passes, we will not be authorized to provide remote learning for more than 10% of our population. And that comes from the data that unless there are very unique circumstances where parents can be, have the availability to be at home with their child and support their learning at home, that they're not going to be successful. And so the agency has made those recommendations. Legislatures have adopted those recommendations. And even if we're allowed to offer remote learning, it's going to have to be a very, we're going to have to have due process in how we ensure that only those that meet the criteria and have the right conditions for themselves at home will be approved for remote learning. Now, what we don't know is the effects of a short learning, a remote learning environment, right? Like what I'm speaking about is what happened over the course of an entire school year. So maybe we're authorized for remote learning, and there's a group of students that are able to do that for a short period of time during a particular surge or a particular circumstance beyond the remote conferencing I was speaking about. So those things remain to be seen. And I think things will become more and more clear in the upcoming days and weeks, and maybe the next time we speak, there'll be some significant changes to report. I'm sharing where we are at this particular time, and like we did the last 18 months, we've got to be patient. We've got to respond to our current situation. I found myself many times, and our staff many times the last 18 months, and us as a community having to make the best decision from a series of bad decisions, right? So I'm not suggesting that everything I'm talking about today is the absolute best decision or the right decision. What I'm suggesting is that they're the best decision given the set of decisions that we have options to choose from. And we'll continue to do that and improve the circumstances as we're able to do that. I hope we get some, at the end of the day, I hope this virus recedes. and we can get back to a more safe conditions that we feel more safe within as a community at large, right? And for our children. But in the meantime, we've got to mitigate it, and we feel like everything that we'll be doing will continue to mitigate it, and that hopefully in short order we see some additional options for vaccines, some boosters, more, herd immunity, and that as a medical community across the world, really, that we tackle this virus and live with it into the future, because we'll always have to live with it in a way that is more familiar, like the cold and flu season, and we don't have the fear of what we've experienced in the last 18 months and here recently. So can only ask for your partnership, your patience, your grace, and we'll keep getting better as we're able to do so, and we'll make the best decisions given the set of decisions that we have to choose from.
All right. And then, for the parents that, I think one thing you might want to touch on, Superintendent Toscano, is East Central, or really public education in general. What role do they play in a child's life? Because, for the comments that are coming in that, it's not our right to tell them how to parent, and that's not really what we're doing anyway. What do you have to say about that? When people say like, "Oh, this should be our choice," we are the parent, and we're allowing that choice. But where does public school come into play in a child's life?
Well, that's a super broad question, but I can say that fundamentally speaking, we're here to work in partnership with families to support the educational values and interests that they have and expectations they have for their children in terms of outcomes and experiences throughout the course of their time with us. And so if we can't align in partnership, then we're neglecting to meet their needs. And that's an aspiration and a commitment that we've always taken into the work that we do as a community here. But it plays an important role. I mean, we know that many of our students, our children, are suffering. They're suffering because of fear. They're suffering because they haven't, in many cases, had an opportunity to be with their friends and to experience what they know to be normal in terms of school. They're suffering not only social and emotionally, but many children have experienced trauma that we have the ability to support them and families with in partnership, that maybe is new trauma, that maybe has exacerbated trauma they've experienced in the past. I mean, we know that we have a lot of students that have been sick, a lot of students that have fear that they're going to get sick and die because of COVID-19. They've seen people in their families, neighbors and friends get sick and maybe even pass. And so, these are traumatic circumstances. And if I'm not in school, it's harder for us to provide the resources that we have available. We, have an extensive partnership with communities and schools that we've expanded. We have teams at every campus working together with the community at large and in our East Central community to provide all of the support, academic, social, and emotional, and trauma response for children and families together to make sure that, not only are we safe physically, but we have all of our needs met so we can continue to thrive, academically, and that we sustain that support the entire time children are in our system. And so school does play a big role in the community. It plays a big role in a child's life, but obviously none bigger than, the role that parents and families play in the home. And when we work together, we can do our best work for kids and in supporting the goals and the expectations families have for us, for their kids.
All right, so we have hit our hour. Actually, we're a few minutes over our hour. One quick question you might be able to answer quickly. Visiting schools right now, if the parent wants to visit a school, what is the situation on that?
Yeah, so our intent was fully on Monday for the littles. We have obviously our youngest learners the first time they've been at school, and in some cases, quite honestly, we're going to have some second graders coming into our schools that haven't been into a normal school situation because of the last 18 months. And there's some circumstances always on that first day that parents want to walk their child in and make sure they get where they need to be and have what they need. We fully are prepared and expect to do that. We fully expect to have all of our Meet the Teacher events. We had our middle school Meet the Teacher events last night, well attended. Everything was fantastic. And everybody took care of one another and themselves, outside of any directives or mandates. And so I know that we'll all do what we need to do, but we need our families and our kids in our schools to the extent possible. And so, when we're in phase 4, as we are now, and possibly phase 5, we've got some language around, just limiting visitors. And so, our principals at the campus level know that, that just means, we got to be a little more diligent case by case to make sure that we are a little more careful about how many folks we let in and where they're going. Are they going to the same place? And how long are they going to be there? And can we all get on the same page around, what are the requirements that we have at this particular time, and expectations, and how are we going to make sure that we're all on the same page and taking care of one another. So at 4 and 5, we just have to be more diligent about it and limit it where it may not make as much sense. But as we regress back to 1, 2, and 3, it's all systems go as we would routinely welcome families and visitors into our schools who have an educational interest in the children that we're serving.
And so we don't know really what's going to happen next week. I mean, we're kind of caught in this little, juggling.
Yeah, it's frustrating and confusing. I get it.
It is, because we don't even know the guidance, right? But beyond Monday, what can happen as,
Yeah, we know that Monday there'll be there'll be more activity in the local courts. The judge is going to have to weigh in on whether this is a temporary order or now a permanent order. And then based on that decision, we know that the state has an opportunity to, ask for a direct response from the Supreme Courts. We know that. That's what we understand. All of those things can happen relatively quickly as it relates to what does it mean in the court system to be quick? I don't know if that's 2 days, 5 days, 10 days. I really don't know. But things are going to happen. And we don't know exactly what the outcomes of those things are going to be, but we know that whatever ends up happening, we'll just have to unpack it and figure out what it is that we're obligated to do. Again, whether we agree or disagree or like it or not, and then we'll communicate with our community, and our board will take the appropriate action where they need to act, where they have discretion to do that, and we'll keep moving forward.
All right. So then we have gone beyond the hour, and I want to be respectful of your time, Mr. Toscano. But I do want to thank you for giving us this update and giving us this time. Is there any final closing comments?
No, I think I've repeatedly, said I appreciate the East Central community so much and what we did together over the last 18 months. And, there were bumps in the road then, and a lot of uncertainty, and, ebbs and flows of what we had to do to, kind of seamlessly maneuver along the way. And, to the extent that we can, focus on our kids and our community, and, not allow those things to disrupt or distract us, then they're likely to not be disruptions or distractions. And at the end of the day, if we can work together, our kids are going to benefit over time, and that's all we want to accomplish. And I know it's not going to be easy. And I know there's no easy solutions. We're just going to keep doing the best that we can, and keep trying to align everything we're doing to the community's expectations and values.
Definitely. Mr. Toscano, thank you very much for your time. To all the viewers, thank you very much for tuning in. The same links that you took to get here to watch this Facebook or YouTube Live, they're always going to be there. You can watch it at any time. And again, we want to thank you. If they have further questions, Mr. Toscano, where can they direct them?
So I would encourage you to talk to your campus administration. We do have, obviously, social media that we monitor throughout every day. So there's an opportunity there to interact with us. We have talk to us tabs on every page to include every campus page across the district. That's an opportunity. We monitor that feature daily as well. So that's another way to get information or to give feedback and to ask questions that we'll respond to. And so, if you work through the campus, if you work through those channels, you're going to get your answers much quicker. And believe me, all the way to my office and at the board level, we're aware of all of the feedback that we get. And we're aware of how we're responding to those to make sure that it's aligned with what we're actually doing.
All right. All right. I want to thank everybody for watching, and remember, working together as a community, we can accomplish a lot. So again, please keep monitoring our social media and our website and ecisd.net/health, as we'll continue to update you as soon as updates come in. Have a good night.
Thank you, Brandon.